Weird Medical Mysteries, Part
Do.
Dos.
Part do.
Yes.
You say two, but with a do.
Do. It's
Do.
put in Spanglish.
It's Spanglish. It's not real Okay, anyway, that's what we're doing. Ready, set,
Let's go.
go. Jello, I'm Ash.
And I'm Lynn.
And this is Only If You Can Keep Up. Okay, ready? We're going to do the crazy medical things that you don't really hear about but are true.
Yeah.
And they're kind of fucking crazy.
They really are.
Okay, you go first.
So I'm going to start with, they call it walking corpse syndrome. Or...
So like zombie?
Yeah.
Okay.
Well, kind of. They kind of think they are. They're not really. Like, they're not physically dying. But they think they are. Or they think they're dead. So...
Okay.
Yeah, it's
Intrigued.
called walking corpse syndrome or Cottard syndrome.
Cottard.
Cottards. I think it's Cottard syndrome.
Okay.
I hope I'm pronouncing it right.
It's okay.
Cottard.
I think you did good.
So they believe they're dying or dead or that they just don't exist at all. Like a form of nihilism. Like nothing is happening. Nothing is here. I'm not real. I'm not alive. That
Is this
kind of
like
thing.
psychosis?
It kind of can be.
Right?
So it can be like secondary to other like mental illnesses or brain injuries, things like that. It usually stems from something.
Something in the...
And it can be
brain?
different. There's not very many cases of it. Only about 200 cases known worldwide.
Oh my God.
Yeah, so it's very, very rare.
Yeah.
But it's like an extreme, not just like I don't want to be here or I don't feel real, not like just derealization.
So it's not like depression type feelings, kind of, or like
they
you said,
usually are
derealization.
severely depressed.
Okay.
And sometimes suicidal.
Well, I mean,
but most of the time they think they're dead.
If you think you're dead, I would assume you're depressed.
Yeah.
You know
like
what I mean? So,
not able to function and be out in the real
so
world.
wait, they truly think they are dead.
So it's they either believe they are dying, parts of them are dying, or that they've already died, or that they just don't actually exist. So it's different for each of them, but it's really like a form of nihilism. So the belief that nothing has value, nothing has meaning, or that nothing actually exists.
Huh.
And it is a neuropsychiatric disorder. So, and it can come with other things. Like it can be caused by a brain injury, caused by like mental illnesses, sometimes schizophrenia, or like Alzheimer's, dementia, stuff like that.
Oh.
But I've even seen it associated with like people with MS or people with migraines or epilepsy, which is concerning because I have a couple of these things and possibly others.
Okay, but
people who have had strokes, people who have but it's not very common, obviously, to have it. But they usually have something else that has affected their brain
before having this syndrome. So it's not like one day I wake up and I feel like I'm dead or I'm dead. It's...
Well, that's what
you
one
have
of
an
them,
underlying condition.
Yeah. Well, one of the guys actually, they don't have a lot of research on it, but one guy actually did just like wake up one day. It was, okay, I'll get to that here.
Okay.
First of all, it was, no, that's my fault. I'm getting off track here.
The Adderall ain't Adderalling yet.
It ain't.
It's okay.
Where was I? What was I talking about? Cotard. Not Cotard. Cottard. Cottard syndrome. Here we go. Okay. So it's first described initially in 1880. It's a long time ago. In 1880 by a man named Jules Cottard. And he was a French neurologist and psychiatrist. So this is way back. Like,
would you say 1880?
Yeah. This
is that's like way the fuck back.
This is like Nikola Tesla time.
Oh my God. Here we go with your love. I'm going to make you a shirt that says I love Nikola.
Please do.
Okay.
I would love that.
Oh my God.
Tesla's biggest fan with a heart. Okay, so this was initially started with a woman they called Mademoiselle X. So a patient, 43-year-old woman, was under delusion that she had no brain, no nerves, no chest. She was just skin and bone. She didn't believe that anything actually was in her. Like she thought she was incapable of dying a natural death. So she knew that she was alive, but she almost thought, not that she thought she was immortal.
I was going to say, did she think she was immortal if she couldn't die?
It was like she believed she was unable to die because there were so many organs
missing. Okay, so this is like pure psychosis, right?
I think it's neuropsychiatric. So it's psychiatric, but stemming from a neurological thing.
Okay.
So like your brain does something neurological and then causes a psychiatric.
Okay.
So in her case, she refused to eat. She eventually did die of starvation, but it's because she didn't think that she needed to eat.
She didn't think she had a stomach to eat with?
She didn't think she had like the things that normal people have. Of course, this was so far back. There's not a lot of research on it.
I was going to say, that's just people writing notes on a notepad that have to get passed down in order for us to see them. So,
yeah.
Okay, so she was technically the first case?
Yeah.
Okay.
And even like all this time, they don't have a lot of recordings. But there was a Scottish man, and I want to say this was in the mid-90s. So this was more recent.
Oh, yeah.
And he developed Cotard syndrome following a motorcycle accident. So probably brain injury, brain damage. And it was reported in Psychology Today. He was...
Okay, sorry, I have to jump in just because I have a question. So it's people who have some kind of a brain issue, injury. You said Alzheimer's, you said injury, motorcycle accident, that kind of stuff.
Yeah.
So is it kind of like I had a motorcycle injury. I hit my head, probably had a surgery or something going on up there. And then it's like one of those things that something so big and traumatic happened to me, I think I'm dead.
Yeah, so in this guy's case it was. Sometimes it's just severe migraines and all of a sudden I'm not really alive. Or it's epilepsy and it's never exactly the same.
Right.
And the situations are always different. They either think they're dead, they think part of their body is dying, they think that their organs aren't there. They think that they're, not real.
This is fucking crazy.
I know. This guy, the Scottish guy, he did have a motorcycle accident, caused brain damage. He was discharged from the hospital, but he believed that he died in the accident.
Okay, see, that's what I was thinking.
Yeah, he woke up, brain injury caused him to think he was dead. He's like, I'm not really alive. I'm actually dead.
Right.
I died in the accident.
So, okay, it has something to do with it. When I was a kid, I got attacked by a dog, and, in my adult life, I've literally had the thought I'm not saying I have this syndrome by any fucking means, but in my adult life, I've had the thought go through my head that what if that dog killed me?
Yeah. And what if this has just been a dream? Or
exactly. What if I'm in a coma since I was 14?
Right.
I've had those thoughts
before. And that's
before.
why I can see those kind of thoughts can turn into delusion type.
With a head injury,
yeah.
I can see how that can turn into an actual, because then I didn't obsess over it. It was just a thought that went through my head and it's kind of oh well, cool.
Right.
But for them, maybe it turned into an obsession and you truly start to fucking believe you are not alive.
Yeah. And maybe part of your brain that thinks it's real is affected. I mean, we don't understand the brain fully. So
that's fucking,
but
this is
insane. He got so severe that he was moved to South Africa, evidently. There was a warmer climate, and he eventually believed that he was in hell, that he had died and gone to hell because of the hot weather.
A hotter climate.
Yeah, but that's all I could find on him. But yeah, that was caused by a physical accident causing brain damage. That he just woke up and thought he died, and he never thought he was alive again until he thought he was in hell.
Right.
And then there was a 53-year-old woman, and this was from a 2008 case study. I'm not sure when this happened, but 2008 case study published in the Psychiatry, an article. They just called her Mrs. L. She was admitted to the hospital following an unusual 911 call. Her family was requesting urgent help because their relative believed themselves to be dead. She thought that she smelled like rotting flesh, and she wanted to be taken to a morgue. Take me to a morgue. I'm dead.
Oh,
my flesh is rotting. I'm not alive.
Did she have?
It was Cotard syndrome, but they don't know what caused it.
I mean, did she have Did she have Alzheimer's or dementia or the start of any of that? Did it say?
I never read what caused that one.
50, 60...
53, so not very old.
But
not really. You could.
Early onset, yeah.
You could. And I didn't read on that one exactly what caused hers, but...
Okay, so, I worked at a nursing home for many, many years. And we had residents, I'm not, once again, saying they had this syndrome, but we had residents that had Alzheimer's, you know what I mean, had that or dementia. And they would say, I'm not even here. Why should I eat? Yeah. I'm not alive. Why should I be here? Yeah. Just the thought. Once again, they take that thought. These ladies, they eventually did eat.
And I think this is actually more common. It just isn't recorded. Especially with dementia patients and people with brain injuries and things like that.
Because you got to think with dementia, you think a totally different thing is happening or going on until you just don't think anymore.
Yeah, and the delirium takes over to where you're just
100%. Yeah. My grandma died from it, so like I get it. Like, thinking I'm not here because this isn't my world.
Right.
I'm not at home in my kitchen where my brain is, so I'm not alive. I get it.
And I deal with a little like derealization, dissociation stuff sometimes with all of my anxiety and stuff. Right. So I can really see how someone could go full on like not believing that they're there, or
if it just takes it and runs with it, and it like you like never snap
like
back
an
out
initial
of it.
Like, what is this world? Where am I? And then all of a sudden, I'm not even real. I'm not even here. I can see how that could take over. And if you don't have anything to snap you back into it, there was one. 2013. So this is just the last 11 years. A man named Graham.
Jesus Christ, 2013 was 11 years ago.
Isn't that crazy? Right? Following an attempt to take his own life, he received a serious electric shock in the bathtub. He tried to kill himself. So this was just severe depression causing a suicide attempt. But he woke up and believed that he actually did fry his brain. So in this case, he thought he was dead because he thought his brain was fried.
Didn't he though?
Yeah.
I'm not trying to be like any way, but like if you take a toaster bath, then
so he was physically alive and talking and everything, but he thought that his brain fried, so he died. So I couldn't find more on that, but just
that's fucking crazy.
That was like, and I get near death experiences. I mean, he lived, but he didn't think he was living.
Okay.
So he's like, my brain's fried. I'm dead. I'm not alive. Like I'm not
dead. But
I died in the bathtub.
But I'm gonna go to work. But I'm dead.
Yeah.
You know what I mean?
And maybe like that is just psychosis. Like if he was so severely depressed, mental illness.
I bet it's kind of hard to.
And he wanted to die.
Say the word differentiate.
Yeah.
Differentiate psychosis in this, because psychosis is such a big pool.
Yeah. Oh yeah. And it can be.
This is just a symptom
of so many things. Yeah. So yeah, this is just a specific type of psychiatric thing, but they're all so different. Each case is different, so it's kind of an umbrella term, because some people think they're already dead. Some think they have worms or bugs eating their organs, so that they're slowly dying.
I've heard about the bugs in the skin, so it's not that.
Not that. Okay. Well, I mean, they're all different. So if they think that if they think the bugs are killing them, then, or that their flesh is rotting or dying, then it could be Cotard syndrome.
Could you imagine thinking your flesh was dying and I'm dead? Like,
I can't imagine. That's what's weird. Like, I can totally see how someone could get that far. You almost have to have a like neurotic brain to even think about it.
I think I could see like the Alzheimer's patient, the dementia patients, and the head injury patients. Yeah. I could see that.
But to sit there and think, because I've had panic attacks where I'm like, I am dying, I'm dying. Well, but it's different.
Dying is different than I'm dead and my flesh
you're
is
alive. Right.
Exactly.
But some of these think that they are dying and there's no way back. Like something is completely destroying my body. Bugs, worms, whatever is eating me alive, and there's no coming back from it. Some think that just parts of their body have died or don't exist. Not like phantom limbs, but like...
My leg is dead?
Yeah, like I don't have legs, or I don't have organs, so I can't eat, or I can't walk, or I'm not leading to I'm not alive.
Right.
So it's like sometimes it starts with, I don't have these parts of my body. They're just not here. You know, they just don't see them as real. So I wonder
if the people in that case where they don't think they have organs, I wonder if they got like an MRI and they were shown their organs.
Maybe.
If they would believe it, but probably not. If it's psychosis. Yeah. They'll be like, look, nothing's there, when there's obviously stuff.
Well, and it's hypochondria and severe depression almost always go with it. So they may start as a hypochondriac, like, which I have been at times, very hypochondriac, like, oh, something's wrong, even though I know it's not. Like, I have bad health anxiety, so I could see how someone could get to a point of delirium of like, oh, something's really wrong.
Listen, if you ever start saying the words like, I'm dead, my organs are dead, my flesh is rotting, I'm just going to go ahead and take you straight to the hospital, okay? We'll just get you checked in.
I could see me jokingly say, like, when
I'm just saying, like,
my skin issues flare up, and I'm like, oh, my skin's rotting, here we go. Or like, because I'm always like, here, I'm going to drag my meat sack around. Like, I say weird things like that anyway, but I could see how someone with mental, and it's not always mental illness, you know, because it can be just a migraine causing severe depression, or an epileptic episode,
or
a seizure,
a brain injury. Like, that's not a mental illness.
Yeah, so it's like it's real to them, but usually the patients are already pretty hypochondriac,
Right. Yeah.
Is that, what's the adjective for
Yes.
that? They have hypochondria, or they're severely depressed and sometimes suicidal already. So
Right.
most of them probably want to die, or are trying to their brain's trying to subconsciously look for a way out, maybe. Like, I can't physically kill myself, but I'm dead anyway, so it doesn't matter. I don't know.
Right.
But the treatment for it, they, obviously therapy, antipsychotic meds, anti-anxiety meds, antidepressants.
So just a cocktail of cumfuckery.
And different types of therapy, talk therapy,
So
behavioral.
I wonder if back in the 1800s when old lady whoever had it,
Mademoiselle.
I wonder if they did shock therapy to try to shock her ass
okay,
back.
so they still do.
Oh my god,
yeah,
shut
ECT
up.
or electric convulsive therapy is still a treatment for that.
Whoa. They still do that today?
Yeah. You watched House, right? Like, I mean, that was just 20
like back
years
in
ago.
the
They
fucking
did
2000s.
Yeah.
Because we're no longer in them.
We were just watching an episode the other night. My husband was laughing at me. I'm like, that's what I need, electric shock therapy for my brain. Like, when I get so, like, worked up and I can't. Yeah, sometimes. I mean, in this case, the guy's memory was completely gone.
But they actually do it to people still? Like,
I'm pretty sure.
I'm sure House is a TV show.
For certain things, I think they do, especially like for like if they're having like really bad seizures, or I'd have to look this up. I'll look this up later. We're taking off.
The airplane's taking off again. I don't know what, it hasn't done that in so long.
It usually only does it at my house.
That's so annoying. Okay, anyway, what else?
I'm looking this up. Do they still do electric shock therapy? I think they do in like really specific cases. Yes. Still used today as a treatment for severe mental health conditions, considered one of the most effective treatments for a range of psychiatric disorders.
Shut the fuck up.
When other treatments have failed. It can cause side effects, of course. It can erase your memory. It can damage parts of your brain. But in severe cases, I could see... I mean, I've been at points with panic attacks and stuff where I'm like, I would try it. Give it to me. Or like I have nerve issues that are, severe nerve pain. Like I would take in my brain, my face, like
even with all of the risk, you would shock yourself.
When I'm in with my trigeminal neuralgia, when that's so bad, I would take it.
But like not when the pain's bad. Like, would you have a different decision when the pain's like right now? You're fine.
Right now I would not.
Exactly.
But in the middle of a flare up, when I can't see or eat or swallow.
Pain, I guess I could get that. Okay.
Well, they call that suicide. What is it? What do they call it? The suicide disease or something like that.
That's a totally different.
Yeah, but I could see how someone gets that point, like, give me anything to stop it. Or a doctor's like, we've exhausted all options and the seizures won't stop or the pain won't stop or whatever. Okay. See, I can see why they still use it in very, like, controlled settings.
Did it. I thought that was, like,
I don't think
omitted
it's, like,
with
a regular go-to.
The fucking lobotomies. Like, I thought that was...
Well, I mean, I think they probably still do very controlled lobotomies.
Oh, my God, stop it.
I mean, where they have to remove parts of the brain or, like, work on parts of the brain to remove certain... Let me look that one up.
I can't with this.
Not like old school lobotomy, like my wife's a bitch and she's whining all the time.
Well, that's what I'm talking about.
But like for certain brain disorders or things to like remove certain parts. Are lobotomies?
Oh my God, stop. We're really going to Google it. They're watching you at this point. You know that, right?
Rarely performed today.
See, they don't do them.
Obsolete.
Mm-hmm. They gone.
But there are surgeries where they go in and like have to remove parts of the brain. So that's what I was thinking.
But I was talking like full ass lobotomy style. Okay.
Not like that.
Okay.
Where was I? Okay. So some of them are just kind of subtle with it. They'll just spend a lot of time in the graveyard thinking that's where they belong, or they just get really depressed and they don't want to eat. But they've actually done studies of the brain activity, and they say it appears as if someone was in a coma or under anesthesia or in a vegetative state. So their brain actually is acting as if it's not
That's fucking
functioning.
Crazy.
Even though they're talking and they're doing the things, their brain thinks it's dead. So it's not like...
So it's
not totally psychiatric. It's also neurological. Yeah, it's
Jesus.
a weird thing, dude. But yeah, other than like electrotherapy and regular like talk therapy and meds, it sounds like a lot of them end up dying.
How is talk therapy going to help someone like this?
Maybe like cognitive behavioral, like to kind of redirect your... I don't know.
I don't think talk therapy would help at all. I don't know. I don't have it. But
I mean, you can only hear that you're not dead so many times. Exactly. You're still going to... Your brain's going to say what it's going to say.
Because at some point you would want to shake him and be like, I'm shaking you. You feel the pain. You feel the things. Like that means you're alive. Like, I don't know. That one's insane.
I know. And it's such a like kind of vague and broad thing because it can cover so many.
Right. It's an umbrella.
Yeah.
Just like everything else in this fucking world.
Yeah.
Any other diseases. Okay.
Excuse me.
My turn.
Yes, please.
Are you good now?
Take over now. I had to clear my throat.
Okay, so I'm doing something nothing like yours. Well, no. Okay, it's called Karu.
Oh.
Karu disease.
I haven't heard of this.
Okay, yeah, I hadn't either until I did a deep dive on the weirdest things in the whole wide world.
Yes.
It's no longer a thing. Don't worry.
Oh, they fixed
like
it?
period. Well, I don't know if fixing it's a thing. Okay, it's also called the laughing death.
Oh.
So you laugh yourself to death.
Wow.
Like that's a symptom.
Kind of like constant nitrous.
It's a extremely rare illness caused by a contagious protein called prion that is found in the brain tissue of people who have the disease.
Wow.
Okay, so like you have the disease and I eat you. Like I'm serious. Like I take a bite of your flesh, I will now have the disease.
So it's only cannibalism type of stuff?
Pretty much, yeah.
You can't get it from eating animals?
That's in here. We'll see.
Okay.
The only way to get it is to ingest the tissue or have the protein enter through an open wound.
Okay.
So you could also have it and bleed into my cut on my leg.
Oh, we're out in the woods and we both get cut and we fall on each other.
Exactly. Yeah, you could give it to me.
Okay.
Okay.
But I had to have gotten it somehow.
Oh my gosh. It was first identified in the Fore tribe in the highlands of New Guinea. So this is nowhere around here in the southwestern Pacific. So it's in a tribe. So this is a very, very long time ago. It was first discovered in the 1950s. Okay. But they also believe that it actually started 50 years before that, at the beginning of the 20th century. So they think it'd been a thing for a really long time, but they finally named it because
found out more.
A lot of people actually had it. People in this exact population had a ritual of eating the tissues of their dead, including their brains.
Oh, that'll do it.
That'll do it.
And I guess, is that still considered cannibalism when they're dead?
It was a ritual. It was a death, it was their tribe's ritual. Like, they did a whole thing, and they would consume some of their person. It was more like a spiritual thing.
That
Technically, that is cannibalism.
Yeah,
I mean,
because cannibalism is just eating human flesh. Period. It doesn't matter if it's dead or alive.
Period. Yes. So I mean,
and I can see ritual.
And you have to think this is like in 1900 when this started.
I'm not judging. I mean, if whatever brings you closer to your whatever.
I don't know.
I wouldn't eat people, but
some of those who ate the brains, they died from it. Like obviously, I mean, you eat the brain. Like this person has it. Who got it from this person? Who got it from that person?
Right.
And now you have it and you essentially die. In 1960, the New Guinea government discouraged the ritual completely. Like they went around to these tribes and were like, no.
That's probably a good idea.
Please die. The practice did stop because like these tribes were like, yo, our people are dying after we eat flesh. We should probably stop.
The only spiritual benefit is death.
Right. And the disease, it did decline after that. There was about 200 people who died a year.
Wow. Turns out it's very contagious.
Right.
God.
It was reported for years after that because the disease had a very, very long incubation period. So like in 1900, I ate my brother's brain, but it didn't affect me until 1950.
Huh.
Like it can be dormant in your brain.
Kind of like how a parasite can sit.
Literally, yes. Yeah. It can sit for a year, 50, 100, like you have no idea. Like the numbers actually dropped really, really low, but then they skyrocketed again years later because the people who had stopped doing it had still consumed the brains and the flesh of the people who had it.
Yeah.
And it's just
it probably kind of like dormant and then...
Right. Exactly.
Wow. And think of just one tribe or one... I don't know, just started up again out of nowhere for a ritualistic thing. Like, because those tribes are on the world.
And then you also have to think the blood contamination is a thing too. So even if you stop eating the food, if you get blood, like even a piece in your mouth or something like that, like you're the doctor of the tribe, the witch doctor, whatever you are, and blood gets in an open wound you could have it.
Right.
You know, it's a very...
I bet it's out there more than we realize.
Not anymore. The last known person with it died in 2008.
Oh, that's not that long ago.
No, that really isn't that long ago.
Last known person.
Yeah. Yeah.
Was there anyone around here? Did it say like in
No,
North America?
This was all mostly over there, like in New Guinea. It was not like an American. It was mostly within these tribes around, you know.
So it didn't like spread across the world. Like, we're eating people and then traveling.
Right. There was at one time 2,700 recorded cases of people with the disease.
Wow.
And if you get the disease, you die. Like, there's no coming back from it. It is a protein in your brain. They can't give you a medication to make it better, or you can't eat a leaf and make it better.
Lobotomy.
No. Some of the symptoms include clumsiness, muscle jerks, slurred speech, severe mood changes, severe arm and leg pain, bursts of laughter for no reason, difficulty walking, and severe headaches.
I have these problems too.
Do you have Karu?
No, but I have severe autoimmune disorders.
Same thing, right?
Right? Maybe. Yeah. Let's scan my brain again.
There's two more. Sorry, next page. Difficulty or swallowing and complete malnutrition. You can't, like, at some point, like, the laughing is the number one symptom. Like, you cannot stop laughing long enough to eat food.
Wow.
It's a constant laugh. Like, you can't stop. Like, you can't, like, and literally laughing kills you. Like,
So the last thing they do before they die is they literally laugh
themselves to death, yeah.
Probably deprived of oxygen and then just, like...
everything.
Wow.
Yeah. They think how it started. How it actually started. They think a person spontaneously, say that 5 times fast, developed the genetic prion disease. Okay. It's actually a genetic disease.
I was wondering, like, where it came from originally.
They think it just happened in the brain.
Soil.
That brain was then ingested by the tribe. And you got to think 50 people eat the brain, 50 people could possibly have it. And then 50 people eat those brains, and you go on and on and on.
What makes someone just genetically develop something, like, out of nowhere, you know? Like, that's just so pops. Weird.
You cannot get actual Karu from eating animal brains, but there are other diseases you can get from eating animal brains that are like the Karu's the umbrella.
Mad cow disease.
Exactly, mad cow disease. It happens when you eat contaminated with meat.
Because even, like, things like E. coli and different food poisonings can eventually affect your brain. Like,
you eat the I can't say big words today. Contaminated meat. Oh my God, from cows. It's called bovine spongiform. I'm not gonna say that word. It's called BSE. Is what's technically.
I've heard of that.
Okay, BSE is a prion disease, which the prion is the thing that causes the Chiron disease.
Okay.
So it is like a form of the laughing disease, but it's not. It's an animal form, essentially. Yeah. Okay. By 2019, more than 200 people worldwide had acquired a prion disease from eating beef tainted with BSE. So it's just a different form of it.
Yeah.
Yes, this was like the Karu is a human form.
Okay.
And these are like animal forms.
Yeah.
So we have seen it before.
Different
it's just
strand of,
mostly in animals. This is the human I'm talking about. Everyone with it dies.
Wow.
Like, no, you don't.
It's not cute.
It's a proton that goes to your brain. It's not, like I said, medication does not cure. They're especially dangerous because the normal method used to kill viruses, like bacteria and stuff like that, if you try these things, it enhances the disease. Oh. So if I take an antibiotic, it makes it worse.
Oh, wow.
You know what I mean? Like, it enhances the disease and it makes it grow stronger and bigger. So there is absolutely no cure for this shit.
That's crazy.
Right. For a long time, the experts thought that a very strong disinfectant, or if you sat in the heat or in the cold for a long time, was the only way to destroy it. And those people died faster than the people who they didn't do that to.
So it didn't work.
Exactly. Yeah, they thought, but in the last few years, the researchers, I can't today, have found that a non-toxic hypochlorous acid solution will disinfect it. Will get it.
I doubt you can swallow that. Or
This is mostly for, like, say I go in with mad cow disease, they can now clean this room properly.
Okay.
It's not for the person.
So it won't spread. Okay.
It kills
the surface
proteins. Yes.
You can't really
surgical
ingest it or inject it.
So. I think they're trying to find a way to, because people do still get mad cow disease.
Yeah,
like, that
some
is
way to isolate the parts.
Exactly.
That are,
There's absolutely no treatment to cure or control or do anything with anybody with a Chiron disease, like including the Karu, which is the human one. Absolutely none. But like I said, after they said no more cannibalism, the numbers went down. Then they had a spike, and now they're gone, and it has completely disappeared. Like I said, 2008 was the last known case of it at all. So as of right now, we know nobody with a Carew disease, like mad cow.
That's like one like. I don't even want to say it.
But here's my thing. Okay, that person with that disease, if the incubation, oh my God, incubation period is 50 years.
You've got decades. In 2008, we could easily
2059, there could be more because somebody could have ate that flesh or got blood on him from your blood. Yeah. You know what I'm saying? So, like, cross your fingers we don't come back. The prognosis is the long incubation period is the problem. Because some people, it can happen instantly, and some people, literally years and years and years and years. The longest they've seen is 50 years. Okay. And then they get it, and you just start laughing and don't stop until you're dead. Makes you wonder
if it's like a genetic thing that just formed all of a sudden in a brain, how many people are born with it? Like, or can it be passed on since it's a genetic, like...
The first person was a genetic mutation.
Wow.
So, yes, possibly.
I feel like there's more out there.
But, I mean, you've got to think... This was also in 1900, essentially.
Yeah.
So, the genetic mutation, could that be from, like, what the parents ate and did and how they lived?
Maybe,
You know what I mean? So, like, we don't do that anymore. We don't live like 1900s.
Most of us don't, anyway.
Well, I mean, some
parts around the world, but, you know, those that don't have advanced medical and stuff, we'd probably never hear about it anyway. Like, third world countries and tribes out in the forest.
Crazy,
I don't know what I'm saying. You know what I mean?
Yeah.
Like, there's probably parts of the world that still do things like that, but we just don't know about their medical history.
Exactly, because we don't know anything.
And they're not going to come here to spread it, so.
After you have it, that was a good slurp.
Sorry, I'll slurp my Dr. Purple.
After you have been diagnosed with it, after you have it, it usually takes 6 to 12 months before you're dead. Like, it's not long. Like, it's very quick. A year.
I mean, at least they're laughing when they go. I don't know.
I think it's painful. I don't think it's like a fun, happy laugh. I think...
Well, the other symptoms are terrible.
Okay, if you think, like, laugh and don't stop. Computer's taken off again. 3, 2, 1. It has not done this in so long. And I made sure she was updated and everything.
I don't know. Little lady, what are we going to do with you?
We need to name her. Maybe if we name her.
Teresa?
No, I know someone named Teresa.
I do too. I don't know where that name came from.
No, so a year.
Francesca.
Can you hear us over the fucking taking off of the airplane? God, she's so loud.
That's so loud today.
She needs to calm down. We need to give her some Adderall. Okay, so you get the disease and you got a year to live, and like I said, the laughter is painful. Like, it's not a happy.
Yeah, you're struggling to breathe. You can't see
like I was saying before, I was interrupted by the fucking airplane. Think about laughing. You know, like, say your husband tells you a funny joke and you laugh and you cannot fucking stop laughing because you keep rethinking your breath, about
your chest starts hurting.
Now do that all day.
Yeah, no.
It's painful. It's not a happy thing.
You start pissing yourself, shitting yourself.
Exactly. And then, like, you physically cannot stop long enough to eat or take a drink.
Yeah.
Like, it's a very serious...
That'd be horrible. That'd be horrible.
Fuck that.
No,
thank you. I'm glad it's gone. I'm glad I never really came over here. This was more of a different country.
Yeah, I've not heard. I've heard of like mad cow disease and different like bacteria and foods causing brain stuff, but like that's extreme. That's crazy.
I know.
But don't do cannibalism, people. Okay,
just
don't do it.
Say no to cannibalism.
Say no to skin and organs from humans
and brains
and brains, especially brains.
Yeah, stay the fuck away from the brains. Okay.
Oh my gosh. I have one more I don't have a lot on, but
that's fine.
I found it interesting.
Okay. You find a lot interesting. You know that, right?
Okay, it's fascinating. I need a new word for interesting. Intriguing. No, I use that one a lot too. Fascinating.
I like fascinating. That has a sparkle.
Fascinating.
It has a sparkle.
It's enticing. This is not really enticing. I would not want this either. It sounds enticing at first because you're like, oh, okay, I wouldn't mind having orgasms all the time. But that's not what this is.
You just sprinkled that on the cake.
I just did a little spoiler alert.
Okay.
Spoiler alert.
What do we got?
After the fact. Persistent sexual arousal syndrome. So it's not constant orgasms necessarily, but you're constantly sexually aroused, okay? It's most common in females. It's just involuntary genital or clitoral arousal that continues for extended periods of times, like hours, days, or even months. Like they're like flare-ups. They don't stop, and they can't identify the cause for it.
Okay, whoa. I have so many questions. So, like, you could just be, like, sitting here chilling and have an orgasm.
Yes.
Like, nothing has to arouse you. Like...
And they don't necessarily climax. Like, they don't necessarily, like,
There's an episode of Grey's Anatomy about this.
I remember vaguely. I think it's something like that. I vaguely remember that episode.
Because, like, her dad comes in and she's like, oh, no. And then she starts to orgasm and covers her face up because, like, her dad just walked in the room and...
Maybe. I kind of remember.
It's okay. Listen.
They don't always get to orgate. Is that a word?
Well, Derek Shepherd fixed her. So, I mean, just do. Oh, damn, he's dead.
Yeah.
Oh, fuck.
Spoiler alert. Just kidding.
Okay,
That was a
if you
long
don't
time
know
ago.
Derek Shepherd's
Right?
dead, that was literally 20 years ago at this point. Maybe 30, because they won't fucking stop making him. Anyway, go. I'm sorry.
But they don't always orgasm. Sometimes it's just, like, really annoying arousal. So, like, there's no associations with, like, feelings of sexual desire. So they may just start feeling like, oh my God, all of a sudden my hoo-ha is just, like,
Let's
gyrating.
Go.
It's vibrating.
Did you say gyrating?
Is that the word? No.
Oh my God.
Like, can't sit still because all of a sudden it's pulsating, it's throbbing, like different sensations. So some will feel pressure or fullness. It's usually women, almost always women. There are a few men. That's like 1% of people, I guess, have it. And sometimes it's subtle and like not so bad. But yeah, some feel like fullness, some feel like throbbing or burning or tingling, itching, pounding.
Jesus.
Pins and needles, just like constant tickling feelings, like, or like your phone's vibrating in there. So it's like, you may not necessarily be horny. You may not get to climax or get off or whatever, but you're going to feel like,
tingling.
oh my God, I can't sit still because my vagina's freaking out right now. Like, and I get pins and needles, like nerve stuff in my legs and my arms.
I get it.
So
sometimes, I get it in my butt cheek.
Yeah. So I could see how that could happen.
That's called sciatica.
Yeah. So it makes me wonder if it is kind of a nerve thing. Like, well, they don't know the exact cause, but it could be a possible blood flow issue or like varicose veins in the pelvic area. It could be caused from cysts or mass.
Do they have a cure?
So
like a nerve blocker, maybe?
Usually they just try to distract them, relax them.
Oh,
different exercises.
Okay. Distract them.
Yeah,
like they can't help when it distract them. That's like
sometimes
internal...
if it's triggered by like sitting or doing certain things, like sitting in a certain chair or doing a certain exercise, then they'll have them like
that's like my stomach growling and I have to try to distract it. That's not a thing.
So like certain exercises, certain meditation things, and then like I guess masturbation sometimes helps, like actually getting yourself physically like sexually aroused and then getting off helps. Swimming, I guess, is supposed to be good.
Oh.
Or sometimes it can set it off.
Okay.
Sometimes,
so do it or don't. We don't know.
Right. It can be like sometimes there's varicose veins in the pelvic. Sometimes there's like a cyst or something putting pressure. But tight clothes can set it off. Mental stress, driving or sitting for long times, like someone who rides a bicycle a lot or sits on a bus or in a car a lot may have more prone to it because of the nerves, the blood flow.
Just breathing, you could fucking feel tingly in your nether parts. Oh my God.
They have topical creams.
Is this common? Like, or rare?
I said 1% of people, so I don't think it's
1%
rare
is still...
It's still, I mean, it's rare, but not...
Super rare?
I think it's more... I think a lot more people have it than what they... Because it's... A lot of people have nerve issues and tinglies, and like, every now and then I'll be like, am I sitting on my phone? Like, and I'll be like, I'll feel a vibrate.
Oh, are you saying you think you have this?
I'm just saying, okay. I think a lot of people probably have those sensations sometimes and
right.
don't realize it's a thing. But if it gets more severe...
I'll feel like my phone's vibrating, but never on my hoo-ha. It's always like in my back pocket or something.
I have restless leg syndrome that comes with all my nerve stuff, and they say that a lot of people with this will develop restless leg syndrome, so it's kind of like that, but in your genitals. Like it feels the tingly and they can't sit still, but it's in, you're like bouncing around because I can't stop the feeling. Like how a little kid can't sit still. I assume that's how it is.
You know what? If I had this, I'm just throwing this out there. If anyone out there has this, have you ever seen the vibrating underwear? Go ahead and put them motherfuckers on and just wear them all day long, so at least you have that sensation.
I just got a recommendation for a vibrating massaging bra the other day.
What the fuck?
I don't know why.
But I'm just saying, like, if you already have the vibration of the underwear constantly there, maybe it will not. Your brain will be like,
reverse effect.
Yeah.
Like, what do you call it? Like, reverse psychology.
I feel like I could deal with the vibrating underwear better than what my body
because you
could
feel
do.
like you're in control of it.
Exactly.
Yeah.
I'm just
saying. That's a good idea. Well, and one of the treatments actually is shock too.
I am a doctor, right?
Right? We're doctors. We're doctors. I would say not a doctor, but I feel like I am. But they do use shock therapy for this sometimes.
The brain shock therapy?
This is more like
whoa. They shoot a probe up your vagina.
I don't know
Shock
about
therapy.
I don't know how they do it. If they just do like little, because they've got like TENS units and stuff that you can use for nerve stuff. So maybe it's something like
put it
that.
on their hoo-ha and hit
I
the
don't know if
button.
they put it in there, but maybe on like the nerve surround. I didn't read too much into that, but it did say something about shock. There's topical creams that can kind of numb the sensations, anticonvulsants like seizure meds. Because if it's a nerve thing or something with your neurons, I don't know, ice baths, I guess, to numb it.
Oh, okay. I can
But
see
a lot of these people develop panic and agoraphobia because they don't want to leave the house. Yeah, I would not want to leave if I was constantly vibrating.
I mean, maybe if I put my vibrating underwear on, I could handle the day.
Yeah,
but...
okay, I'm in control of this. I started this. It's not so bad.
I feel like I'm making fun of this. I'm really not. That just seems
it would be
to
miserable,
like,
but
that seems like a good solution.
Yeah,
but
I
don't
feel
know.
like it would. It's almost like reverse psychology for yourself,
Right.
or like I'm in control, so it's not bothering me, kind of thing. But it does suck because it's not like they don't get sexual pleasure out of it. It's more annoyance. Like,
oh yeah,
when my nerve stuff's bothering me, I'm getting pins and needles and my leg goes numb and stuff like that. That drives me crazy. If that happened in my vagina all the time.
Okay, so like whenever my sciatica acts up,
yeah,
I've got one of them guns, the vibrating.
Yes.
What do you call them? Muscle.
Like a massage gun.
Massage
I've got
gun.
one of those too.
And I will do it like from my hip to the top of like my lower back. I will do that entire area and the tingling goes away.
Yeah.
So like to me, common sense is
right.
get you some vibrating panties.
Yeah. And if it's a nerve thing, that makes sense. But this, they don't really know. Is it blood flow? Is it veins? Is it nerves?
True.
Is it? I mean, I guess it can be set off nerve compression. Like, because I have compressed nerves, and I'll get like, oh, my arm will go numb out of nowhere.
Oh, my
so
arms
I think
are
it's
numb
probably.
now.
So how do you fix the compressed nerve up in your hoo ha? Like, there's gotta. I'm sure there's more
stick a
out
rod
there.
in there and click go.
Right. Clit go. Sorry. But
Thank you.
sometimes it's not up there. It's just in like the clit area.
Right.
And so, I don't know. Ooh. Yeah, no, that would burn. I was thinking about like, like the muscle relief.
So excited.
Like the pain relief
Like
patches.
Bengay?
And like the nerve roll on. That would burn so bad. Oh my God. But I'm like, I guess I could see people getting like desperate enough to where, please make it stop.
Okay, if that's not going to make it stop, that's going to have a whole new... Then you got more problems.
I need a vagina transplant, please.
I don't think those are real.
No, I don't think so.
Maybe.
Uterus, maybe? I don't know.
Oh.
I don't know. Never thought about that.
Huh. Anyway,
Yeah, that would be annoying for sure. And it can cause agoraphobia. People get depressed over it. They get super anxious, don't want to leave the house because it can be so severe.
I mean, I wouldn't want to either.
Yeah. And it's, persistent sensations of genital arousal. Intrusive and unwanted. That's what it said. But it doesn't always have, usually no association with sexual desire. So there's like no reason for it. Just comes on out of nowhere. But I think it's more nerves and blood flow.
Could you imagine like legit having that? And like, I would never want to have the actual sex.
Right?
Because you feel the way, like, I stuttered a little, you feel the way like the whole day.
Yeah.
And then someone's like, ooh la la, come on.
I assume it's like the equivalent to like blue balls for a guy, maybe. Like, you feel like, oh man, I've been stuck like this.
But you said like
can't...
tingling and pounding and all of those things too.
Yeah,
so
there's
like,
different. Sometimes it's painful.
But my thing is if I've got any kind of sexual arousal the entire fucking day,
right?
Don't touch me.
Yeah.
Like,
and that I said sometimes masturbation can fix it temporarily.
Yeah,
but you wouldn't even feel like wanting to.
I don't know. That's horrible.
Yeah. So anyway, thought that was interesting, but interesting, intriguing, fascinating, enticing. I got to come up with some more adjectives.
You say interesting so much, and it's so cute.
You found it interesting.
I love it. It's
super
okay.
intriguing.
So if you would like to get a hold of us, you can do so at onlyifyoucankeepup@gmail.com.
So interesting.
That was cute.
Love you. Bye.
Bye.